Today I'll be talking about a case of multiple myeloma in a 55-year-old female. This clinical case was published in the Journal of Medical Case Reports. First, I want to talk about what is multiple myeloma. And MM is a cancer that arises in the bone marrow. This cancer comes from the plasma cells, and these cells make up the smallest component of the bone marrow. I'd like to talk about the four main cells that make up the bone marrow. It'll help to give a better understanding of why this cancer is so detrimental to the bone marrow and eventually the surrounding tissue. 60% of white blood cells, 60% of the cells in the bone marrow are white blood cells, and these are the immune response cells. 20% of the cells in the bone marrow are red blood cells, and these are the hemoglobin cells that carry oxygen throughout the body. And 1% of these, or 10% of these cells are platelets, which are important for blood clotting, and 1% of these cells are plasma cells. And plasma cells are the cells of interest in the case of multiple myeloma. When you have a greater than or equal to 10% infiltration of plasma cells in the surrounding tissue and also in the bone marrow, you can characterize that as multiple myeloma. Here we're looking at two bone marrow samples. On the left, you can see a wild type bone marrow sample where you have normal amounts of red blood cells, normal amounts of white blood cells, and normal amounts of your plasma cells. On the left, you can also see that the red blood cells make up most of the cells in this slide. On the right picture, you can see that the plasma cells have infiltrated the surrounding tissue. They have made themselves at least 90% of the cells that make up the bone marrow, and this is where you have a lot of the symptomology that comes with multiple myeloma. You can see later in this clinical presentation, this patient clearly exhibits a lot of the symptomology that arises when you have plasma cells that have infiltrated. Here are some statistics from the National Institutes for Health. The NIH says that 52.2% of patients who get multiple myeloma have a 5-year survival rate. And this is important because multiple myeloma, for those who do survive, is not curable. This is a lifelong cancer, so even those who live past that 5-year mark need constant treatment. And most patients today can live pretty normal qualities of life. Occasionally, there are flare-ups of the multiple myeloma which require medical intervention. 32,000 cases of multiple myeloma were diagnosed in the United States in 2019, which is a pretty large number. So in this clinical presentation, this 55-year-old patient presented to the rheumatology department with polyarthralgia, joint swelling, a 5-kilogram weight loss, fatigue, and joint pain. And the polyarthralgia is when you have arthritis in multiple areas of the body. The joint swelling goes along with that. A 5-kilogram weight loss is pretty common in most cancers, and this was sustained over the past 3 months. The fatigue, when you think about the cells that are damaged in the multiple myeloma, makes sense because if you're having an infiltration and a destruction of the red blood cells, you're going to have an anemic patient who is more tired, and this fatigue would make sense in that case. You're also going to have joint pain, which is due to a breakdown of the calcium and protein that makes up bone. So upon examination, this patient was pale, cachectic, which is pretty common with most cancers, edema, so there was a fluid buildup in the soft tissue, a debilitating loss of joint function. This patient could not even feed herself when she was brought to the clinic. The Tinel and Phelan's test resulted in a positive diagnosis of carpal tunnel, and this test is pretty simple for the physician to do in the clinic. It's done where you do some palpitations of the hand and the joint here, and you're trying to stimulate the neuropathy and tingling sensation that arises with carpal tunnel. The Phelan's test is where the patient would take their hands and put them down like this, trying to stimulate that sensation of neuropathy and tingling that arises with carpal tunnel. There was also moderate cool effusion in both knees, which is a fluid buildup in the space in between the joints. Lab and radiology results showed clear indication of multiple myeloma. The first lab result we're going to look at is a synovial fluid cytology, and this test is where there was a biopsy taken via a needle being put into the space in between the joint to take out some of that synovial fluid. And the synovial fluid showed plasma blasts, multinucleated cells, and chondrolysis. The plasmablasts and the multinucleated cells clearly indicate the cancerous transformation of the cells. The chondrolysis is interesting because it indicates that the space in between the joints begin to break down. And in the bone marrow biopsy, there's also a consistent finding with that chondrolysis, and that there was amyloid present in the blood vessel walls, indicating that some of the proteins that make up that tissue in between the joints began to break down and make its way into the bloodstream. There was also strong plasma cell infiltration, which is the main characterization of all multiple myeloma. Hand X-ray was performed, which showed joint space narrowing, so indicative of swelling in the space between the joints. Going back to the slide where we can see the side-by-side of a normal biopsy and a multiple myeloma biopsy, you can see now that we've identified a lot of the symptomology, it makes sense in light of these two cell cultures. You can see there's much less white blood cells, much less red blood cells, and mainly you have those plasma cells, which would give rise to the amyloid deposits. So for the clinical diagnosis, the patient was diagnosed with multiple myeloma stage 3. All three pathogenic features of arthritis were seen with this multiple myeloma, which are erosive arthritis, carpal tunnel, and invasive tumoral arthritis. And the tumoral arthritis is really interesting because that would be a direct cause of those plasma cells infiltrating. And when you have that metastatic phenotype of the invasive tumoral arthritis, you're going to have pain, joint pain, and a lot of those arthritic symptoms. So for the treatment plan for this patient, they did a VAD, which is a triple cocktail chemotherapy regimen, as well as an antibiotic. The antibiotic that was used here was adrenomycin for the chemo, vincristine was used, dexamethasone, also cyclophosphamide. And this patient did not respond very well to this treatment. Unfortunately, the patient died 7 weeks after the initial presentation. This case is really interesting because normally these comorbidities, which are the arthritis, would be identified after the diagnosis of multiple myeloma. In the case of this patient who had pretty advanced stage multiple myeloma, the comorbidities helped to ultimately identify that main diagnosis. Credit here to the Journal of Medical Case Reports, also HealthTree University on myeloma, and the National Institutes of Health for the multiple myeloma cancer statistics. Thank you.